1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Good morning, everyone. Before proceeding to the program proper, let us first take note of the webinar rules and regulations. The following should be observed in attending the webinar. We encourage all the attendees to please mute your microphone when not speaking in order to minimize background noise. We highly encourage everyone to be in your most comfortable dress in order to be focused on the webinar. We highly suggest all our participants to have a pen and a notepad at hand in taking down notes for your reference while attentively listening to all our speakers. If you have a question or clarification during the presentation, you may type it in the chat box or comment section. The program host will bring them up during the question and answer portion of the webinar. Your thoughts, ideas, and recommendations are highly significant to the organizers. Please do fill out the evaluation form that will be posted before the end of the webinar. Every participant who was successfully registered and accomplished the evaluation form will receive an e-certificate via email. Good morning, ladies and gentlemen. Good morning, Philippine. We are gathered here today to witness the very first webinar of MPA students from the CBIBE department entitled COVID-19 Vaccination Program. This forum aims to inform all of us about the latest progress about the vaccination program in our country, particularly in the City of Manila, and how this program will impact the amelioration of the Philippine economy. My name is Windy A. Bagak, your Master of Ceremony. Today's webinar will really be interesting because our topics are very timely. Of course, we hear updates from the news about how it's going, but I think it would be best to hear it firsthand from experts who really immersed in the field of health and economics. Before anything else, I would like to take this opportunity to welcome everyone who is watching from home. Thank you for streaming with us. To officially begin, may I call on Ms. Mirasol Alger for an opening prayer to be followed by the Philippine National Anthem.
Let us put ourselves in the presence of the Lord, in the name of the Father, and of the Son, and of the Holy Spirit. Amen. Almighty Father, we thank you for gathering all of us today to be part of this important webinar. May you bestow your guidance and blessing on our guest speakers so that they may share their knowledge with us for your honor and glory. Bless the student organizers and faculty members who worked hard to make this webinar possible. Bless also the participants that they may be able to participate and appreciate the significance of this webinar in their lives. Now that the COVID-19 vaccines are becoming available in the country, may you encourage each and every one of us to go out and get vaccinated, as this is our only hope to combat COVID-19, save our lives and the lives of others as well, and to free us from economic hardships. Father, we pray that you will continue to protect us and our families from this pandemic. Teach us to appreciate what we have in this time of fear and uncertainty. All this we ask through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Thank you, Ms. Alger. To give us her opening remarks, it is my pleasure to welcome Dr. Sionida A. Baes, the Class Advisor of Urban and Regional Planning and Philippine Administrative and Legal System. Let us give her a warm virtual round of applause.
Okay. To our beloved President, Dr. Yang, Dr. Sunosa, to the different department heads of PWU, faculty members, students, and our guest speaker, Dr. Lacsamana and Dr. Balita, good morning. I am pleased to welcome you to the webinar on administrative implementation of the vaccination program in the City of Manila and COVID-19 Vaccination Program, the key to Philippine Economic Recovery. It aims to provide key input to the view about vaccination. In this virtual conference room, I am sure we understand the importance of COVID-19 vaccine, in which can help to protect our body from virus. Thank you very much for attending this seminar.
Thank you, Dr. Sionida A. Baes, for that welcoming message. We hope that you enjoy the rest of the program. Before we proceed to our program proper, let us first listen to an inspirational message to be given by our beloved PWU President. Everyone, let us welcome President Marco Alfredo M. Benitez.
Dr. Felina Young, University Chancellor and SVPAA, our hardworking faculty from the Conrado Benitez Institute for Business Education, distinguished speakers, dear students from our Masters in Public Administration program, as well as all our guests watching on social media, good morning. I'd first like to congratulate the organizers, our students from the Masters in Public Administration program, under the guidance of Dr. Sionida Baes and Dr. Maria Victoria Rosas, for the timeliness and relevance of your webinar topic, COVID-19 Vaccination Program, its administrative implementation in the City of Manila, and its role in economic recovery. Let's begin with some numbers. As of June 27, the country has already fully vaccinated approximately 2.5 million Filipinos, or roughly 2% of the population. We're averaging 236,000 vaccinations per day, the highest 7-day average since the start of the campaign in March, but still just a third of the 600,000 daily vaccination target needed to achieve herd immunity by December 2021. The City of Manila, which is the most densely populated city in the country, has been lauded by many for its multifaceted response to the pandemic, even receiving an award from the Department of Health in October of last year. The city was one of the first to establish free drive-through testing sites at the Quirino Grandstand and at the Andres Bonifacio Monument, apart from the walk-in testing centers in 5 of its hospitals, 2 molecular labs at the Santa Ana Hospital, and 2 mobile testing clinics that do the rounds of the barangays. Early on, the city had also established at least 13 quarantine facilities, and just this month opened its 336-bed capacity mega field hospital at Luneta Park. Another critical element of the city's response has been the food distribution program, where food packs, both LGU and privately funded, are distributed to barangays that are locked down due to confirmed COVID cases in their area. These food packs help alleviate the need for members of these lockdown barangays to have to venture outside to source food, thus further minimizing the risk of spreading infection. As for its vaccination program, the city has prepared at least 18 vaccination sites to cater to its many districts, apart from its partnership with several malls that have agreed to serve as mass vaccination centers. Each vaccination site has a capacity of 1,000 to 2,000 vaccinations per day. Another noticeable feature of Manila's vaccination program is the simple and accessible online registration process, which doesn't even require you to be a resident of the city, and the acceptance of walk-in registrants in all vaccination sites, unlike other LGUs that strictly require a confirmed vaccination schedule. This open and easy access, in my opinion, has been one of the key drivers of Manila's strong performance in administering vaccines. In fact, in a meeting with Mayor Isko and our South Manila Educational Consortium last May, he candidly mentioned that the city is capable of administering at least 25,000 doses daily, given enough vaccine supply, and thus cover its entire eligible population with 2 doses in a matter of 2 to 3 months. Now that vaccine supply has ramped up, about 10 million vaccines arrived just this June. The city will hopefully be able to consistently deliver on its 25,000 daily vaccination target. Like many local chief executives, Mayor Isko and his administration recognize the importance of vaccination as a critical element in combating the pandemic and reopening the economy, especially in a city as densely populated and as heavily reliant on commerce as Manila. Likewise, it is also obvious that they have also addressed other important elements in addressing the pandemic, such as testing, tracing, quarantine and isolation, and the implementation of public health protocols. While we can say that no response has been perfect, the City of Manila's is definitely one we can all learn from, given its unique characteristics and challenges. And I look forward to gaining more insights in today's webinar. And before I end, I would just like to remind everyone again to please get vaccinated. Protect yourselves, protect your loved ones, and the rest of the PWU family. More and more of our members are getting their jabs, and the sooner we can all get vaccinated, the sooner we can end this pandemic. Thank you once again, and good morning.
Thank you, Mr. President, for that heartfelt message. Indeed, we felt moved by your words of wisdom. Now, allow me to welcome the participants of today's webinar who pre-registered prior this event. You may leave a comment on the comment section below as I mention your institution. Philippine Women's University, Lorma Colleges, Philfida or Philippine Fiber Development Authority, Velasco Hospital, City University of Pasay, Manila Central University, KOLFF Dialysis Incorporated, St. Benedict College of Cotabato, Victoria's Milling Company, Far Eastern University, Manila, St. Teresa Dialysis Center, Ministry of Health, West Visayas State University, PWU CDSEC Bataan, College of St. John Paul, Sodexo On-Site Services Philippines Incorporated, Taguig City University, Wesleyan University Philippines, Navotas Polytechnic University, MDRRMO San Fernando, National Teachers College, Romblon State University, Taguig City University, Western Philippines University, University of the Cordilleras, Cebu Pacific, University of Caloocan City, Western Mindanao State University, Iris Manila, Our Lady of Fatima University, TCMC, St. Louis University, Physician Diagnostic Services Center Incorporated, Cebu Pacific Air, and Arellano University. Thank you very much for your time, and we do hope that you'll enjoy today's webinar. To all our virtual audiences who weren't acknowledged earlier, please let us know the school you're associated with or the city where you came from by leaving a comment on the comment section below. Of course, you may also share this live video to your friends so they can also learn from today's webinar. So it's about time. Let us now proceed to the first part of our webinar. To introduce our first speaker, may I request Ms. Myla Jimenez to do the honor.
Good morning, everyone. Welcome to the webinar on administrative implementation of the vaccination program in the City of Manila. I take this opportunity to welcome today's guest speaker, Dr. Aileen Lacsamana. Dr. Aileen is a hospital director of Hospital ng Sampaloc from July 2019 up to present. She has completed Doctor of Medicine from Pamantasan ng Lungsod ng Maynila. Later on, she pursued her master's in public administration from Philippine Women's University. Dr. Lacsamana became the OIC Health Officer in charge with the operations and management of the Manila Health Department. As an experienced medical officer, she was involved in planning and implementation of the basic health services of the local government unit and other administrative functions. It is an honor and privilege for us, Dr. Lacsamana, to have with us today. I also welcome administrators, professors, and colleagues. Today, we have gathered here for the webinar arranged by PWU MPA students. I am sure we will definitely listen to a webinar from Dr. Lacsamana. Please join me in welcoming Dr. Lacsamana.
Hi, good morning, everyone. Can I have be the co-host so I can share my screen? All right. Good morning to everyone. So I am privileged to be the speaker for today's webinar at Philippine Women's University. As you all know, I am grateful to the university for providing continuing education for me, and proud to say that I am an alumna of the prestigious Philippine Women's University. Anyway, this morning, I am tasked to deliver a presentation about the vaccination program in the City of Manila. But my disclaimer would be, although I work as a staff of the Manila Health Department, being the hospital director of Hospital ng Sampaloc, which is an LGU hospital, I am not part of the technical working group who is directly handling the vaccination program. So this presentation would be like a narrative, a story of Manila's roadmap to vaccination program. We've heard the president, Mr. Benitez, earlier saying, enumerating the achievements of the city with regard to COVID-19 initiatives, not only in the vaccination, but in the curative aspect of it. As early as March 2020, the Manila Infectious Disease Control Center was opened. It is in Santa Ana Hospital. So the hospital catered to COVID-19 positive cases. Eventually, because the city realized the need for diagnostics, which is the gold standard, RT-PCR is the gold standard in the diagnosis of COVID-19, the city eventually opened its molecular laboratory, as what the president has said. And because of this, the city was able to provide free RT-PCR testing to numerous, not only Manilans, but non-Manilans as well. And the hospital where I work is fortunate to be able to conduct free swab testing to numerous patients. So with my presentation today, I hope that the students, especially the MPA students and the other viewers would be able to identify, pick up good administrative management practices from the city of Manila. We are very fortunate that we have a dynamic, a visionary leader who is guiding us in the city. As again, as what our president said, the city is quite complex. It is the second largest city in the Philippines with an estimated population of 14,158,573, and the population differs in the daytime and the nighttime. Third, it is the most densely populated city with a number of like 42,857 people per square kilometer. So we just imagine the complexity of the demography as well as the topography of the city. So in the city, we have a working arm, and it is the Manila Health Department's task to deliver primary health care services. And the Manila Health Department is headed by Dr. Arnold Pangan. There are 46 health centers in the city, and there are 6 LGU hospitals. So each district has its own district hospital. But take note that although the services in the city, all the services are free, this isn't exclusive to Manilans. Even non-Manilans are welcome to the city, to any of the health centers or the hospitals in the city, whether the service required or needed is COVID or non-COVID. And to date, although the focus is COVID, all the health centers and the hospitals within Manila are still delivering primary care services non-COVID. So during the pandemic, we transformed our hospitals from purely non-COVID into the required 50% bed capacity by the Department of Health. So currently, Hospital ng Sampaloc, where I work, allocated its wards into COVID wards, and we are managing moderate to severe cases. The president mentioned the opening of the Manila Field Hospital. Currently, since it has numerous beds, 330 or more, non-COVID cases with mild symptoms can be admitted and be quarantined in the Manila Field COVID Hospital. So let's now proceed to the Manila Vaccination Plan, or the MVP of the city. The Manila COVID Vaccination Plan was crafted with the help of course, the technical working group of the Manila Health Department, and this was based on the guidelines of the Department of Health. Our mayor, Manila Mayor Francisco Isko Moreno Domagoso, was very careful in the planning process, and more so in the execution of the plan. So early on, I think it was January 19, 2021, Manila had its first simulation drill, and it was conducted at the Palma Hall of the Universidad de Manila. And in that drill, the mayor said that the purpose was because we want to achieve, to practice together with our Manila Health Department, the hospital directors, and all the medical frontliners. They wanted to see all the possible scenarios that may slow down the process and avoid mishandling of the vaccines. Well, we all know that certain vaccine brands have strict cold chain handling, so that it is very important to the vaccination team that we are able to handle the vaccines, whether brand A or brand B, so that all the vaccines that the participants will receive, or all the people who are willing to be vaccinated, will be assured that the vaccines are of optimum condition. This is a milestone in our roadmap to vaccination, and this webpage was launched on January. It was created towards the last quarter of 2020, and it was launched on January 1, 2021. It is the www.manilacovid19vaccine.com. So what is the role of the webpage? I think this is the first among the LGUs. Manila was the first among the LGUs to have created a platform where the people willing to be vaccinated would pre-register in order to avail a slot for vaccination. Well, the mayor was always saying that vaccination is a voluntary act. But of course, for the administration to be able to prepare a program, especially procurement of the vaccines, it is important to create a database so that the city can plan how much the city needs in order to achieve the herd immunity, for example. prior to 2021, the mayor already set aside a budget of 200 million pesos, which will be appropriated to purchase COVID vaccines. But during that time, the NTF and the Department of Health aren't allowing yet LGUs to procure vaccines. But later in my presentation, we'll see when the President Duterte signed the Republic Act number 11525, it allowed now the LGUs to procure vaccines through a tripartite agreement with the national government through the National Task Force. Of course, all programs of the city, all the initiatives of the city with regard to vaccination were aligned or are aligned with the mechanics or the guidelines set by the Department of Health. So this is an article that was published in January 21. So I don't know if our viewers now or the viewers in this webinar were able to access WW. It's easier. It's like an elementary platform, easier to use because any effort, any initiative of the city, the mayor always takes into consideration that it shouldn't be difficult to use, that it will be easier for any class, any person, whether that person is educated, uneducated, would, so long as it has access to connectivity, would be able to register himself or let his relatives register for himself so that he can be counted for the vaccination. So the Manila Health Department created a specific a group, and it was called the Manila COVID Vaccine Action Center. And the objective was to prepare the city's roadmap to vaccination. I said a while ago that the demography is complex. Manila is divided into 6 political districts, and we have 897 barangays in the city of Manila. And it is important to identify strategic points, strategic locations on where the vaccination site will be held so that it will be accessible to the people. And another thing, it is important that the sites will be wide and open so that we'll be able to exercise safe protocols, especially distancing. It's important because although the participants already pre-registered and answered the questions like they haven't experienced any of the COVID symptoms in the last 14 days, they weren't exposed to people who had COVID, but of course, because we all know that there are asymptomatic cases, the person isn't showing yet any symptoms referable to COVID, but is already carrying the virus. It is important to practice safe distancing. But we are thankful to the non-medical frontliners like the Liga ng Barangay, the Manila Barangay Bureau, the Manila Disaster Risk Management Office, because they help the medical team, the medical frontliners in making sure that the vaccination process in all the sites are well organized from the start of the when it opens until the last person is vaccinated. This diagram shows a vaccination process flow in a site. This is the process flow that we utilized in our hospital. So note that in the process flow, we follow a one-way system. So a person gets in, registers, so there's an encoder, and then the encoder would scan the QR code that the person is carrying. So for example, Miss Baes comes into the vaccination site, and she is told to carry with her a screenshot of her QR code or a printed QR code together with a health declaration. She presents it to the encoder, and then the encoder will check if she is indeed in the registry list. Upon seeing that, one of our doctors would then recheck, ask her again the set of questions that she answered with regard to her medical history, her exposure to COVID, allergies to vaccines, drugs, food, any previews in the last 14 days, vaccination with rabies. These are questions that are part of the guidelines set by the Department of Health. So if Ms. Baes answered no to the questions and is not exposed to COVID, so she is qualified to receive the vaccination. Her vital signs will be checked, her blood pressure, her temperature. So, and then if the temperature is normal, she doesn't have fever, her blood pressure is normal, meaning not beyond or above 150 over 100, she is then fit, well, to receive the vaccination. Ms. Baes now will proceed to the vaccination area where she'll be given the brand that is available, the brand that was given by the Department of Health. So now we know that we are not anymore announcing which brand of vaccine in social media, of course, but it is but at the vaccination area, when the person receives the vaccine, he or she can ask what vaccine brand will be given to her. It is her privilege to know that information. After the vaccination, she then proceeds to the post-vaccination observation area, where she will wait for 15 to 30 minutes for any adverse symptom. In the structure, there is always the presence of an EMS, emergency medical service, who anticipates any vaccine participant will develop an adverse event. But of course, since the start of the vaccination on March 3, 2021, there haven't been any report of patients who developed adverse events following vaccination of any brand of COVID vaccine. I was fortunate to have been part of the first group of medical frontliners who have received the vaccine. Of course, we all know that our Vice Mayor Maria Sheila Hani Lacuna Pangan was the first public health or public officer to have received the vaccine in Manila. So the vaccination plan is worldwide. and the WHO set a national deployment vaccination plan for COVID-19. And we adhered, each country is required to submit its NDVP. The purpose was to assist the countries in making sure that all the key elements that are required, that should be part of the NDVP, are present in the plan. And this is very important in the deployment and implementation of COVID-19 vaccination in all the countries. The document the document contains four important requirements: target population, so the information on the identification and prioritization of the first 1 to 3% of the target population. Of course, very important is the plan for supply chain and logistics, costing and funding. The plan can be used to work with donors such as the World Bank and the COVAX facilities for the procurement of the vaccine. We know in our country that the vaccines that we are using now in all the local government units are coming from the COVAX facility. These are donated vaccines to our country. When the President signed Republic Act, President Duterte signed Republic Act 11525, or the COVID-19 Vaccination Program Act of 2021, it authorized the national government and the local government units to undertake negotiated procurement of COVID-19 vaccines, while private entities such as the Philippine Red Cross were also authorized to procure in coordination and cooperation with the Department of Health and the National Task Force. Important to note that the Republic Act provided immunity from lawsuits of certain individuals. It is a fact that all the vaccines passed phase 3 of vaccine development. And we are using the vaccines, though they haven't passed phase 4, because we are in a state of public health emergency, or we are in the pandemic. And it is important for frontliners like me to be protected from lawsuits of individuals who would say that they developed adverse events following injection. The Republic Act likewise included an indemnity fund to compensate for serious adverse events following immunization. So how are the LGUs prioritized in the vaccine development program of the Philippines? Under the implementing rules and regulations of this act, under Section 7, the National Task Force, together with the Department of Health, shall review the requests of the LGUs to procure the vaccines to ensure compliance to Section 4 of the Act, stating that LGUs shall procure no more than 75% of their target population for vaccination. So let's say that our population, Manila's population, is 1.9 million in the daytime. So 75% of that would be our cap. But of course, the IRR was saying that it can be adjusted when there is a sufficient supply of the vaccines as determined by the Department of Health and the National Task Force. The national government adheres to the principle of equity. So meaning that equity in the delivery of service would be services are biased towards the vulnerable and the disadvantaged. We are seeing now in Metro Manila that I am not certain about the data now, but we are seeing um, more than 700,000, I think, vaccine doses were already dispensed by Quezon City. 600,000 plus vaccine doses were already dispensed by Manila, and the other cities are likewise following. And being a medical frontliner, that is important to us. What we are seeing now in the hospitals, like the hospital where I work, we see that the cases, COVID cases, somehow have plateaued from our bad, very tiring exhausting experience during the month of March and April, where we see like COVID cases coming in 24/7. Now we are down to a few COVID cases, and we feel that that is because of the aggressive position that the city took in its vaccination, in its roadmap to vaccination. So to date, in the entire city of Manila, I think we only have 1,000 COVID active cases, and not all of those COVID active cases required hospitalization. Last araw ng Maynila, June 24, I think you saw that 400,000 doses of Sinovac arrived in the country and was received by our mayor and vice mayor. And it's one of the batch of vaccines that were procured, paid for by the city. Coming also would be the 800,000 doses of AstraZeneca vaccines that the city also procured through its funds. Who gets a vaccine first? Well, these are the guidelines of the Department of Health, and we adhered with the guidelines. So at the start of the vaccination on March 3, 2021, frontline workers in health facilities, both national and local, private and public, health professionals and non-professionals, were the first batch who were allowed to receive the vaccination. Well, we saw in the newspapers, in social media, that at the start of the vaccination, it was like was an air of hesitancy even among the frontline workers. But it was important for leaders in the health sector to allow themselves to be vaccinated, to believe in the vaccination, so that our staffs will have that confidence to submit themselves as well. It was important in my hospital that all of us in the hospital are vaccinated, because we are catering to COVID cases and we are exposed 24/7 to COVID cases. We know that the vaccines will not guarantee 100% that we will not have the infection. But all the vaccine brands guarantee 100% protection from us developing severe manifestations of COVID. The A2 followed, the A2 group or the senior citizens followed, those are 60 years old and above. So in the pre-registration, it is fitted for individuals 18 years old and above. So when you pre-reg, when you type in, encode your data, um, it is specific, meaning that when you type in your date of birth and you're not, um, you're honest about it, and you're not 18 years old, you won't find a date of birth, a year of birth that is below 18 years old. Eventually, according to the guidelines of the Department of Health, the vaccine rollout included persons with comorbidities and the frontline personnel in essential workers. Because of this, the city needed to expand and identify other vaccination sites. So now we are seeing vaccination sites in the malls, in the cinema. Like today, my vaccination team in Hospital ng Sampaloc, they're assigned in SM San Lazaro, and we start vaccination from 6 a.m. and we end at 8 a.m. The target is to administer vaccines to everyone who will go and be present in the vaccination sites. According to Dr. Pangan, the highest vaccine turnout was on June 22, 2021, where the health cluster, the vaccination team, were able to dispense 30,000 vaccines in one day. This is the advisory of the the National Task Force as to an amendment in the guidance on the vaccination. So now we include now the immediate family members of our healthcare workers. So I think this is important. We are clamoring, the frontliners are clamoring for inclusion of our immediate family members who are not in the A2 nor in the A3 category, because although we are vaccinated, but when we go home, even though we practice all the safety protocols, we are not 100% sure, guaranteed that we won't bring home COVID virus, coronavirus and Cove. So it's important that the chief implementer, the vaccines are, came out with this advisory. There are a lot of reasons why people hesitate to accept. They refuse to be administered COVID vaccines. But it is kind of funny because I do not know if there's an individual who in his lifetime, maybe individuals 18 years old and above, hasn't individual hasn't received any kind of vaccine. Tetanus toxoid, maybe when he got a wound, or maybe for women, reproductive women in their would want to get pregnant, haven't received an MMR vaccine. So there are a lot of reasons why people still hesitate to receive vaccines, and it's not a local problem. Meaning, it's not just a problem in the city nor in the country. It's a worldwide problem. There are issues of complacency, convenience, more so confidence, social demographic context, and the webinar would not be sufficient. The time that I am allowed not be sufficient to discuss, because it's another topic to discuss the reasons why there is vaccine hesitancy. In an article that I saw published by CNN Philippines, got a Pulse Asia survey, which was conducted, I think, February to March 2021. And they did a survey, 2,400 adults. And in the survey, noteworthy is that Filipino adults were not inclined to take any available vaccine, 61%. Only 16% were willing to get vaccinated. Till when can we be able to achieve herd immunity if people will not see vaccination as solution to the pandemic? To me, it is a civic duty for me, and being a leader in the hospital. It is likewise my responsibility, to bring all of my staffs into a position of safety, utilizing the benefits from the vaccine. 63% do not trust the vaccine from China, maybe because of our colonial mentality, maybe because we are brand conscious. But me personally, I received the Sinovac vaccine when it was first, the day following its launching at the Philippine General Hospital. And I did not experience any symptoms following my first dose, nor my second dose. And with, by God's grace, since the start of the pandemic to date, I haven't had any COVID infection. And I am grateful for that. And likewise grateful from the vaccine, because it added protection for me. In the survey, you can see very clear, those willing to get vaccinated preferred Pfizer. 22% preferred Sinovac. So this photo was taken when we had the simulation drill. What are the vaccines that are available in the city? So the vaccines are available in the city are the vaccines that are given to us by the Department of Health. So we've already used Sinovac. We had an experience with AstraZeneca. The simulation drills were conducted specifically for the temperature-sensitive Pfizer and Sputnik Gamaleya. 2 days ago, we were able to use Moderna vaccine. So these are the vaccine brands in the Philippines that have been given regulatory approval. Those in the asterisks are the vaccine brands that the city made arrangements to, no, not the city, the country made arrangements to procure. But these brands, except for number 7, and number 7 and number 5 have already been used by the city. We are down to the last few slides. So just like to show you the process of the emergency use authorization. And I have said a while ago that the vaccines have passed phase 3, although they are all in phase 3, but because of the declaration of a public health emergency, the FDA issued a formal approval for its use. So Sinovac, Pfizer, Moderna, Gamaleya, these vaccines have been given emergency use authorization by the Philippine FDA. Okay, so How do we handle vaccines? Our mayor is visionary. When he was planning for the roadmap to vaccination, he said that he's seeing that the storage facilities would not be sufficient for all the LGUs or maybe in Metro Manila. So he provided appropriated funds for the City of Manila to have its own storage facility. So it is located in Santa Ana Hospital as well. And our storage facility, Manila storage facility, um, can accommodate vaccines which are temperature sensitive, such as Pfizer and Sputnik, and the other vaccine brands, which would only require a +2 to +8 degrees centigrade storage. To date, there are 2 billion in the entire worldwide. 2,660,756 547 vaccine doses that have been administered. Around 22.7 of the total population in the National Capital Region received their first dose of the vaccine, while only 7.37% are fully vaccinated. In the city of Manila, there are 650,562 doses that have been administered. And the city isn't wasting any time when vaccines are delivered to us from the Department of Health. The health cluster isn't wasting any time. The following day, it is rolled out to the vaccine facility, different vaccination sites. Uh, 2 days to 3 days ago, when Moderna became available, 11,000 doses of Moderna became available. It was consumed, it was dispensed in one day to all the different vaccination sites. So to end, Osam protektado, wagi ang bakunadong kawani. This was our mantra in our hospital, and I'm sure in all the hospitals in the city of Manila. We all of us, you would see wearing our vaccination T-shirts. The mayor, you'd see him always wearing his vaccination T-shirt. He's saying that business will not continue. The city, although we are fortunate because our mayor is finding ways to make ends meet for all for the city. Despite the hardships that the pandemic has brought us and the challenges, of course, as a city, um, the moral of the story would be as us public administration students, it is indeed very important to know by heart, to understand and to manifest a sound and a good administration management skills and practices. And we are all fortunate, I am fortunate to have been educated at the Philippine Women's University because I have with me now knowledge on how it is to be a good public health official. And in that note, I thank you all for listening.
Thank you so much, Dr. Aileen Lacsamana, for a very informative talk. Hospital ng Maynila has ended an exemplary orderliness in undertaking the vaccination program in the city of Manila, thanks to Dr. Lacsamana's expertise. Well, I'm pretty sure our audience has plenty of questions to our guest speaker. To have your questions be acknowledged and answered by Dr. Laksamana, may I call on once again Ms. Myla Jimenez to preside the question and answer portion.
So thank you, Dr. Aileen, for the informative talk. We're going to begin answering the questions submitted during today's presentation. So as a reminder, you can still submit questions through the chat box. So our first question is from Ms. Christine M. Torio. So her question is, I have allergic reaction to tuberculin test in 2017. My arm got swollen and blistered. Pwede po ba ako magpabakuna ng COVID-19 vaccine?
Yes, yeah. Alam naman natin sinabi ng Department of Health na wala pong contraindication sa pagtanggap ng bakuna laban sa COVID. Kahit po kayo ay nagkaroon ng allergic reaction sa tuberculin testing, iba naman po ito doon sa bakuna na tatanggapin ninyo. So, doon po sa vaccination site, kung mayroon pong mga individuals who developed allergic reactions, who answered yes to allergies to food, drugs, vaccines, we tell them to monitor themselves, pakiramdaman ang sarili nila upon receiving the vaccine if there is like shortness of breath or hoarseness of the voice at the holding area, and to immediately tell the frontliner at the holding area. Ang sinasabi po sa atin ng Department of Health at ang PISMID, lahat ang tanging contraindication lamang po sa pagpapabakuna laban sa COVID ay yung may allergic reaction doon sa unang COVID vaccine na natanggap. Bukod po doon ay wala na pong contraindication.
Alright, so mukhang nasagot naman yung question, no? Nasagot talaga yun ni Doc, so pwede. So our second question is from Ms. Jubil Cipriano, and her question is it possible for the City of Manila to set up more vaccination sites aside from malls and schools to avoid some residents of Manila to queue and wait up to more than 5 hours to get jobs?
Oo nga, alam mo ano talaga yan, napakahirap. Ang isang challenge kasi diyan, wala namang problema to set up more vaccination sites. But let us also take into consideration the manpower limitations. Hindi po biro ang manpower requirement ng isang vaccination site. Kaya nga po, kung sasabihin niyo po na i-multiply pa natin ito further, that would mean reducing the number of manpower that will be assigned per vaccination site. You know why people are queuing at the vaccination sites? Because, well, we learned from the opening remarks of our president. He said that the vaccination opportunity in Manila is not limited to Manilans only. Kapag naririnig ninyo yung sinasabi ng ating mahal na mayor, kung kayo ay frontliner na nakatira sa Manila o nagtatrabaho sa Manila o may kamag-anak na nagtatrabaho sa Manila, kayo ay pwedeng mag-register doon sa webpage upang makakuha ng bakuna. So dahil doon, napakarami talagang pumupunta doon sa mga vaccination site, and we apologize for the long queues. The city isn't following by appointment. We tried it by appointment, but di ba? Konti yung pumunta, kaya nga nagpunta si Mayor dun sa Robinsons, Manila, and opened it and said that all walk-ins are now allowed, because it is difficult for people to just like wait for their appointment, although that is ideal, but it isn't in the culture of the Filipinos. Let's accept that. So unfortunately, kailangan talaga pagtiyagaan ang pila para makakuha ng libreng bakuna. So that's my answer to your question.
Thank you, Doc Aileen. So our third question is from my co-student. So she is Miss Sol Alger. So she has a question. Yes, Miss Sol.
Hi. My question po, Doc, paano po ba yung vaccines allotment in Manila? Do you request ba as to how many vaccines that you want to receive from DOH, or ang DOH po mismo yung nag-a-allot ng mga vaccines? Like kasi may mga issue, di ba, before na may ibang LGU hindi nakaka-receive ng mga vaccines. So paano po ba yung vaccines allotment?
Okay. I am not part of the technical group of the Manila vaccination plan, but as far as I am concerned, as far as I know, we wait for DOH to give us this volume of vaccines. So wala pong pahingi po kami ng 200,000, wala pong requisition na ganun. Naghihintay lamang po kami, ang city, ng volume ng bakuna at kung anong bakuna ang ibibigay sa city, at yun po yung aming ibinabahagi sa mga tao. So kung ang tanong niyo po ba ay specifically paano ba ang apportionment of the vaccine sa iba't ibang LGUs, ay hindi po namin alam yan sa aming as far as the city is concerned.
Okay, thank you po, ma'am.
Welcome.
All right, so our fourth question po, I have question din po addressed to you, Doc. So unfairness and distribution po of COVID vaccine in the City of Manila. Who got the first rollout of the COVID vaccine implementation po? Is it the poorest of the poor, or who po? Who are the first target of the vaccine rollout?
Well, we follow the guidelines set by the Department of Health, diba? So sa guidelines ng Department of Health, the priority group would be priority group A1. Ito yung mga medical frontliners. And I've said in my presentation kanina that yung medical frontliners need not be exclusive in the city, local or national, public or private, diba? So, and hindi lamang sila medical frontliners, meaning the doctors, all the workers in the hospital, whether they are doctors, nurses, even our housekeeping employees and our security guards, they are considered as medical frontliners. So kasama po sila dun sa A1 na nabigyan. So kung tatanungin niyo po ba ako, the poorest of the poor po ba, ay hindi po natin sila maklasify doon sa economic status nila. So I would just say na kung mga security guards, so mula po doon sa pinakamababang ranggo sa aming ospital hanggang po doon sa pinakamataas na ranggo, ay pantay-pantay po yung opportunity na ibinigay.
Alright, so thank you po, Doc. No? So pantay-pantay talaga yung opportunity na ibibigay. So our last question po, Doc, is from Vincent Oleb. So, and his question is, if dose is completed, is there a possibility to acquire or become COVID-19 positive?
Yeah, oo. Kahit po naka 2 doses tayo, kahit po, for example, you received Sinovac, 2 doses of Sinovac brand, the COVID vaccine brand, that will give you 100% protection that you will not develop moderate to severe COVID infection. But that will not exempt you from developing the infection if you are exposed to a COVID active case. And because of that, we are always reminded that we need to still continue using our face masks, especially when we are in public places. That answers po the question.
Yes po, Doc. So salamat po, Doc, sa inyong kasagutan. And akala ko po may last question na, no? So meron pa po pala tayong follow-up question. Napaka-interesting po kasi nung topic natin, lalo today. So meron pa po tayong follow-up question. What is the hesitancy rate in Manila? And how do you convince your residents to get vaccinated?
Unfortunately, I cannot. I do not have a data. We have yet, I think, to conduct a study on the identifying our hesitancy rate. But siguro I could speak of my hospital, my experience in my hospital. So to date, of my 284 employees in Hospital ng Sampaloc, we are 96% vaccinated already using different brands of the vaccine. So yung natirang 4%, ito yung pregnant because like we know, 'di ba, it's an option for pregnant women now. Pwede sila mag-receive ng Pfizer or Moderna, but some of them are still hesitate to avail it. At yung isa ay out of the country. So ibig sabihin ko, hindi masyadong significant yung remaining 4%. How did I convince them? By example, sabi ko nga kanina, it's important for public health officials to lead by example. Ako, nagpabakuna, walang hesitations because I believe in vaccination. Ganon din ang panuntunan ng ating Vice Mayor, who happened to be a physician. Ganon din ang sinabi ng ating Mayor. So lahat kami na parte ng health cluster at ng pamahalang lungsod ng Maynila, we lead by example. And we want to show the people that yung mga hesitancies about ano bang mangyayari in the future kapag nagpabakuna ako, pag nagpabakuna ba ako, baka magkaroon ako ng malalang side effect. Nakita naman po natin kung kahit hindi tayo mag-Google, nakita naman natin na napakababa naman ang porsyento ng adverse events kahit sa ang brand ng vaccine. Ang sa palagay ko, ang dapat isipin ng bawat isang Pilipino ay ang proteksyon niya sa sarili niya, ang pagmamahal niya sa kanyang pamilya, kaya kailangan niyang magpabakuna, at ang pagmamahal niya sa bansa na kailangan niyang maging bahagi para magkaroon ng herd immunity ang ating bansa at matapos na ang pandemic sa Pilipinas.
All right, so one last question, Doc, from our viewer. So one last more question from our viewer, and her screen name is Mi Amore. So her question is, how long is the effectivity of the vaccines? Will there be a booster dose?
The Department of Health hasn't set out guidelines as to will there be a need for a booster shot, but we are hearing now that maybe after 6 months, the effectivity of the vaccine would just be 6 months, and then 6 months after you would need a booster dose, or it will be like a flu vaccine that you would require a yearly dose of the flu vaccine. We just have to note that the coronavirus is a virus and it's mutating, meaning that maybe to this year, the vaccine will be efficacious for all of us, but when it develops into different variants and when the scientists would test now, if it is still efficacious, will not be efficacious, the same vaccine, and would need to develop a different a different vaccine, no, not a different formulation would be the proper term, which would target the variants in the future. So we cannot say for certain now that that would happen, but of course that is a possibility.
All right, so I hope that your questions were answered by Doc Lacsamana. And again, once again, we are really thankful for us, all of us here, Dr. Lacsamana, for being our speaker today. Thank you again, Dr. Lacsamana. So that ends our question and answer. Back to you, Ms. Wimby.
Thank you, Ms. Jimenez, for that. So, Doc, do you have any last message to all our participants who join us here today? Maybe you would like to say something? You're on mute, Doc.
Thank you to Philippine Women's University. I will graduate on July 24, Masters in Public Administration. Thank you to my teachers, to all the viewers today watching the webinar. Exercise your civic duty. Be vaccinated. Do not be brand conscious. All the vaccines will provide protection against the infection. That's it. Thank you.
Thank you so much, Doc Lacsamana, once again. And thank you to all our participants who actively and willingly asked questions to our first speaker. So now let's move on to the awarding of certificate. So for the awarding of certificate, the Philippine Women's University Conrado Benitez Institute of Business Education present the Certificate of Appreciation to Dr. Aileen A. Lacsamana for sharing her knowledge and expertise as a resource speaker during the webinar event entitled Administrative Implementation of the Vaccination Program in the City of Manila, held on July 3, 2021, given this third day of July 2021 at the Philippine Women's University, Taft Avenue, Manila, Philippines. Signed by Dr. Sionida A. Baes, Professor, Mr. R.B. B. Sabolao, Class Representative, and Dr. Felina C. Young, Chancellor, SVP for Academic Affairs, and OIC Dean of CBIBE. Thank you very much, Dr. Lacsamana, for your participation, and we appreciate your presence with us here today.
You're welcome.
So now we're down to the second part of our webinar. So I'm sure this second topic will serve the best interest of many of us because we want to know how the Philippine economy will be able to bounce back from the loss brought by this pandemic through the ongoing vaccination program. To introduce to us our second resource speaker, may I call on Ms. Micah Angeli Dayao to do the honor.
Good morning, everyone. I would like to acknowledge the presence of our participants who willingly took their time to be with us today. To our dear speakers, colleagues, organizers, and the university president, thank you. I am super excited to have you here, excited about the conversation we get to have today. For our last topic, COVID-19 Vaccination Program, the key to Philippine Economic Recovery, we will be having a very familiar speaker. And to formally introduce to you, let us all watch this presentation.
Receiving the highest honors among 50 top executives all over the world, he finished the executive program in international management in Stanford University and National University of Singapore, and a certified franchise executive graduate in the Philippine Franchise Association. He holds 3 professional licenses, a master's degree, and 2 doctoral degrees in humanities and education. He is currently working on his 3rd doctoral degree. He is the man behind the biggest review center in the Philippines, the Dr. Carl E. Balita Review Center, or CBRC. It has more than 100 branches locally and internationally, thus being recognized as a super brand and has the distinction of being the first ISO 9001-2015 certified business of its kind. CBRC dominated the Philippine Franchise Association's Franchise Excellence Awards in 2017 and 2019, winning most of the prestigious awards. It is the leader in innovation for its online review and training today, making its way to becoming a global institution of excellence in knowledge development for lifelong learning. He owns the Mahalta Resort and Convention Center and the Pedagogy Learning Center. He is a film and record producer, a best-selling author, and a Hall of Fame awardee as host of ABS-CBN DZMM's Radyo Negosyo for almost 2 decades now. A fellow of the Royal Institution of Entrepreneurs in Singapore, he is a respected and multi-awarded businessman, being awarded the Asia CEO Entrepreneur of the Year Circle of Excellence for 2 consecutive years, an Outstanding Professional Awardee in 2018, Asia Pacific Young Entrepreneur Awards finalist, DOST Science Ambassador, University of Santo Tomas Total Awards recipient, and Oriental Mindoro's the Mahalta Award Entrepreneur. He is the chairman of the Philippine Chamber of Commerce of Industry or PCCI in Quezon City and its current national chairman for Human Resource Development, an international motivational speaker, a business professor, and more importantly, a family man. The educational entrepreneur extraordinaire, Dr. Carl E. Balita.
Good day, everyone. From my home in Quezon City to yours, my wish that you are in good shape, you're in good health, and you're happy making the most of this pandemic experience. You know, whenever there is a conversation that has something to do with how we can get out of this pandemic experience or how we can somehow go back to the old normal that we were comfortable with, we give both our ears to listen. And allow me to be a little more pessimistic in the beginning, but very optimistic in the end as I present to you a topic assigned to me. And I'm very thankful and honored to have been invited with the Philippine Women's University. And I'm one of the faculty of the graduate school, proudly of PWU. I'm given the topic that is entitled COVID-19 Vaccination Program, the key to Philippine Economic Recovery. Of course, from the time that the pandemic was announced and the quarantine was imposed, and we heard about this COVID, I have become very concerned about this. And part of my prayer is for the vaccine to be released to humanity for us to be able to fight this well and square. And for me to be talking about the vaccination program being a key to Philippine economic recovery, you might raise an eyebrow, especially for those who have read my article last June 22, when I wrote in the Business Mirror, in my regular column in the Business Mirror, I almost lost my mom due to the vaccine. And I still believe in it. Yes, my mom was so well. She was healthy, living in our province in Oriental Mindoro. But she got a vaccine. She got AstraZeneca. And she did not feel anything after getting the immunization until 10 days after. She felt that her foot was numb, and she called me early in the morning. And I referred her to my friend neurologist in Calapan City, and I was informed that there is an impression and probably Guillain-Barré syndrome, an ascending paralysis, a very rare condition which could be resulting from the vaccine. So it's a post-vaccine adverse reaction. Right away, after hearing that impression, the clinical impression from assessment by a specialist neurologist, we transported my mom to Manila, and she suffered the ordeal of the ascending paralysis, which danger is to reach her lungs so that she will not be able to breathe anymore. She was intubated for 10 days, placed on a ventilator for a week or more, but thank God she recovered from it. But did it change the way I look at the vaccine as a savior of humanity so that we can end the pandemic? The answer is no. I still believe in the vaccine. And take it from me, if we really want to be out of this pandemic experience, we better believe in the science of this vaccination developed by various companies and regulated by many regulators from the World Health Organization. In other words, even if I almost lost my mom from an adverse reaction, a rare case of Guillain-Barré syndrome, I will not blame anyone. I will not blame science for it. I will just say my mom was 1 in a million. And what matters is the 999,999 who could actually benefit from this science-made vaccine. You know, if we look back, they claim and they say that the COVID-19 experience, the pandemic experience, is a black swan experience. It's a black swan where a highly improbable event this is, was unpredictable, which impact is massive, and which has what we call retrospective predictability. And we can only understand this pandemic experience after it's over, because we are unable to truly estimate opportunities because we are too vulnerable to act on impulse, to simply narrate and categorize what we know, and not open enough to rewarding those who can imagine the impossible. This black swan experience is something we've never experienced in our lives and in our history. I mean, in our age, in our era, and hopefully this is going to be the last. And we reacted and we responded to it in different ways. But let me show you our journey. We all started with our reaction, the normal reaction where we retreat to safety. We rested, and sometimes many of us actually denied the experience. We thought that when the pandemic was announced and when the lockdown was imposed, the ECQ we thought was just a 2-week staycation kind of limitation to our movement. And then we retreated to safety. We expected that it will be back in a week or two until we realized that it's not what we thought it is. Then we reflected, given more time at home, given the limitations at home, we reflected and we tried to retool, we tried to relearn, and we rolled with every punch. There were a lot of confusion. Some of us did not like it. We were not comfortable being trapped in the safety of our homes, but that gave us a lot of reflection. And eventually, we realized that it's even taking longer and reflections were not enough. Then we responded. We recalibrated our response. Those who lost their job and who were just using their savings just realized, oh, wait, I have to do something. And then we rechannel our energies. Some of us went to graduate studies. Some of us wrote books, learned how to cook, develop times with their family, make the most of it. Some even had to reboot what we used to do. But responding is not even enough. We have to now recover. And after how many months of quarantine, recovery is the only thing that is left, because we just did not want to survive. We wanted to thrive. And this is where we will rebound. This is where we will renew. And this is when we will run the race. Let us look at the global situation to give more justification that indeed the only way to go is to have this vaccine rolled out and achieve what we will define later as herd immunity. As of end of June 2021, there had been 181,521,067 confirmed cases. Of course, including here are almost 4 million deaths reported to the WHO. Hindi pa po kasali dyan yung mga hindi reported. At syempre kasali naman dyan yung tipong nagkaroon lang ng pigsa, nilagnat, na ospital, namatay, COVID na yon. But the thing is, 4 million deaths are still 4 million deaths. Even one death matters. And look at that. Out of this, because of this 181 million with 4 million deaths, as we speak now, there are almost 3 billion vaccine doses that had been administered. Thankfully, there were pharmaceutical companies, there were companies that really moved to make the vaccines available for all of us. And if we will look at the situation from the regions, you look at this, America had 72 million cases, confirmed cases, followed by Europe. And the Southeast Asia had 34 million, and the rest are numbers. But these numbers could only tell us how worse this pandemic has hit us, taken a hit on this humanity which believed in science. We're so modern, we're so advanced, we thought we know a lot of things already about science and technology, and come on, it took us how many months just to understand the very virus that we cannot see. If you look at the Philippine situation, and let me present it to you at the end of June 2021, from January 2020, there had been 1,408,058 confirmed cases of COVID-19. There were 24,000 deaths as reported to the WHO. And as of June 23, 2021, we hit already 9,542,612 vaccine doses administered. I'm very happy to report to you that as a nurse, as a registered nurse myself, I'm a registered nurse, I'm a registered midwife, and I'm also a licensed professional teacher. And my business happens to be, engaged in bridging the dreamers and the dream to become professionals. We bounced back. We had a teacher's board exam review already. And of course, we're known for the nursing board review. And as part of this contribution, I have gathered the doctors, the nurses, and the other allied health professionals so that we can contribute to some cities in the National Capital Region as we provide vaccinators, screeners, and even frontline workers in the vaccination centers. And I'm very proud to have done that as part of my pivot to make sense of our network of nurses and doctors and allied health professionals. And look at that, 9,542,000 doses and growing. To justify further the need for vaccine, let's look at the global economic impact. The economic impact. I'll be presenting to you the impact in terms of the economy, in terms of jobs and employment, in terms of learning, because this is not only a health crisis, this is not only an economic crisis, this is also an education crisis. Look at us now. I mean, this could have been better if we're face to face. If we can see each other eye to eye, if we can actually smell each other's perfume. If we can shake hands and, come as social animals, coming together and learning together. But we are trying to achieve that same objective through the digital space that we're having right now. Let's look at the global impact. I look at the loss in the GDP. Of course, the highest loss was that from 8.5% in Latin America. The emerging markets had 7% loss. The world in total had 6.7% GDP loss in 2020. Such a bad situation. But to compare the low-income developing countries like the Philippines and like the ASEAN, our loss is not as much as the others because the economy was doing well but not as high as the rest, and that's why the loss is only at 4.8%. But 4.8% GDP loss for a year is still bad. if we will look at all businesses, I'm presenting to you this slide so that we can we can justify to ourselves that we really have to do something to end this pandemic, because as you can see from these slides, almost all businesses went into the red and lost during the 2020 pandemic peak experience. Of course, as you can see, pharmaceuticals grew because of the need for many medications, many supplements, vitamins, etc. The computer, the need for computer, the need for virtual engagements increased the demand of computer. That's why in the second quarter of 2020, there was an increase, and there was a steady increase. That the increase was 11% in the third quarter of 2020. Even textile had an improvement. But look at automotive products, kasi walang nagkotse. Look at travel goods, look at footwear, even clothes. Look at all of those. It all suffered. And as far as construction, as you may see, even the build project of the government contracted by -30. You can just imagine if you're an artist, or if you own cinemas, or if you're a movie producer, what would have happened to your business? But the financial services improved, of course, for a reason that maraming walang pera, nangutang, gumanda ang financial business. Insurance, we suddenly realized that we needed insurance, and computer servicing improved. Well, it's not all red, but generally speaking, the world of business suffered badly. And even employment, imagine this, 8.8% of global working hours were lost in 2020. That is equivalent to 225 million full-time jobs. These losses were so bad that the loss due to the pandemic was 4 times greater and higher than the global financial crisis in year 2009. It's so bad that the worst financial crisis of our modern times is multiplied by 4 times, just to compare with how much jobs and working hours were lost in 2020. As you will see in this slide, by the way, the global, if I may go back, the global labor market disruption in 2020 is far exceeded the impact of the financial crisis of 2009. Sobrang sama ng nangyari. And because of that, the global poverty index really pushed 119 to 124 million pesos. People rather. That's 119 to 124 million people into extreme poverty in 2020. And we're talking of the world. Look at that graph. The target from 2015 to 2021 would have been a steady decline in the baseline projection, in the pre-COVID-19 projection of poverty incidence in the world. But because of COVID in 2019, look at that, we are back even higher than the rate that it was before 2015. And for the first time in 20 years, global poverty is increasing. This is very challenging, and the level of uncertainty is even worse. Now, I have to present this to you because I need more data and evidence to convince everyone that the only way to go to end all of this is through the vaccine. Of course, with the vaccine comes the need for social distancing. We have learned that. The need to wear masks if we have to, unless you belong to the countries that I will present later that have removed the mask already. So there is hope. But that hope is attached to how we can collectively, as humanity and as a country and as a people, embrace the science of the vaccine. And I think PWU initiated this activity because we really have to do something. It's not enough that we learn the need for the vaccine in this conference, but after this conference, we have to go out our way to make sure that we influence people in our circles. And the social media, we should use it to campaign that those who are reluctant to receive the vaccine should go out and get it. After all, it's free. After all, local governments now are trying to make it more convenient. After all, there are very few cases that should scare them. And I have to tell you, I was very reluctant to write about my mother's ordeal of having an adverse effect. You know why? Because I have 600,000 followers on Facebook. I have a show with ABS-CBN. I write in the Business Mirror. I mean, somehow, the moment I express it to the world, I know if there will be 100 people who will read my article, maybe some old people like my mom at 73 or the senior citizens may end up reluctant to receive the vaccine. And I wanted to be responsible. And that's why even the title that I used to communicate my experience and the family's experience ended with a positive note that I still believe in the vaccine. And I had the worst, my family had the worst ordeal with my mom's experience. Look at this, the incidence of poverty. Where is it highest? In South Asia. Ang hirap-hirap na nga natin, nakakulong pa tayo, walang trabaho, walang pagkakakitaan. Ano na lang mangyayari sa atin? Think about it. The economic impact in the Philippines, we have to look into this. Well, look at this traces, this graph from 1982. We almost, achieved that high level of growth. But look at how it plunged in 2019 and how it plunged in 2020. When there are expected forecasts for growth, the pandemic plunge in the Philippine economy contracted worst since World War II and failing at 9.5 in 2020. It is the sharpest dip on record since available data dated back 1947, and also the first GDP decline since 1998. Ganun po kasama ang tama sa atin. And therefore, we're just trying to justify that if we want this economy to be back, if we don't want poverty to move to its worst level and form, we have to do something collectively. And look at the loss of jobs in 2020. That's 10.3 unemployment rate, and that is 16.2 unemployment rate. The annual unemployment rate in 2020 rose to 10.3%, and that is equivalent to 4.5 million unemployed Filipinos. Pero as an entrepreneur advocate and having a show that did not stop even during the pandemic, a business show called Business Above Usual, it used to be Radyo Negosyo. I have interviewed a lot of survival entrepreneurs. Those who lost their job and started a business and now are earning more. Those whose business have actually grown bigger because of the online platform, the reduction of having to rent. I know of a lot of stories where those who lost their job went into business just to survive and realize that they can do a lot more and earn a lot bigger by doing business. Even my review center, we know when the pandemic came, we were only offering 5 programs. Now we're offering 25 programs. You see, maybe we did not grow by profit, but we have grown by the potential by which we will operate post-pandemic. And this is the highest since 2005. In January 2021, the PSA said that some 4 million Filipinos were unemployed, and this is higher than the 3.8 million unemployed in 2020 and the 2.4 million in January 2020. So talagang terrible po yung tama sa ating unemployment rate. And I decided to present to you the graphs of the regions to tell you that, for example, in the Ilocos region, it's even higher at 13.4 rating, you see? And even the National Capital Region is higher than the entire Philippines at 11.7. I mean, for the National Capital Region, at least the market will be there. I mean, magluto ka lang ng lugaw, ilabas mo lang sa labas, it could actually sell for the family to survive. That's why a lot took the road less traveled by, and that's the road of entrepreneurship. Well, the Philippines went into a lot of debts. See, ganyan po karami in billion pesos, yan po ang utang ng Pilipinas. Our outstanding debt rose by 26.7% to 9.7 trillion in 2020 because the government needs more funds to respond to the COVID crisis. As you can see, as I said earlier, it's not only economic crisis and employment crisis that we had because of the COVID experience. We also had learning crisis. And that's why even the education sector, I mean, education of our children, the learning experience, has really suffered immensely because of this. Now, if we will look at the data of June 30, 2020, it was noted that 156 million were affected learners. That's 8.9% of total enrolled learner. And that's in 19 countries where schools closed. And as you can see this, some countries even had to take academic break, where I'm happy that in the Philippines, at least we continued with blended learning. But the challenge is, what was the impact of this, this migration to technology in learning when you know that connectivity is an issue, when you know for a fact that some families don't have gadgets, or even teachers had to learn the hard way in using this technology. You see, the learning crisis took a lot of, students out of school, and a lot of parents in quandary, in confusion on how they should handle this. And the status of our schools are terrible. A lot of schools have closed, the private schools have closed. 28 million learners are affected. And look at this, even college students are having difficult times. And this is not unique in the Philippines. This is also true in other countries, even the developed countries. They had to close their schools, they had to suspend classes, and they are doubting if the student actually learned. But we have to pass them, we have to promote them to the next level. Otherwise, we will have a problem of some academic impact on families and children and even schools. Now, the support had been through online, but look at that. Some went into tutorial, some went into, to home packages, some went into the traditional radio and so on. And hope came when the vaccine that we were praying for came and passed the global standards and some regulatory processes so that it can be, we can embrace some safety nets and can conclude that this will be safe for humans because it had been tested on some, some animal testing and human testing and so on. And in the interest of humanity, we rolled out some vaccination programs. And let's look at the big picture. There's a thing called COVAX. There's a project called COVAX. It's working for global equitable access to COVID-19 vaccine. This is some celebration of humanity because the COVAX is part of the WHO's Access to COVID-19 Tools Accelerator. It's being spearheaded by Coalition for Epidemic Preparedness Innovation, the Vaccine Alliance, and the WHO. The goal is to work with vaccine manufacturers to offer low-cost COVID-19 vaccines to countries. And the COVAX, just to celebrate, the humanitarian spirit of the world, the COVAX offer doses for at least 20% of country's population. You know, if the target is say 80%, 20% of that will come from COVAX. Diverse and actively managed portfolio of the vaccine. Vaccines are delivered as soon as they are available. You know, every day we watch in the news that a set of vaccine came from China, from Europe, from America, and so on. Donors right and left, and so on. Vaccination centers among malls, schools, and other facilities. There are drive-through vaccination centers. There are walk-in vaccination centers. There are even bakuna sa gabi programs and so on. You know, and of course, we want to rebuild the economy. That's why the COVAX became an alliance of these responsible organizations from all over the world. Now, let's take a look at this. The leading COVID-19 vaccine and how many, if you would count, there are 4 from China, 1 from India, 2 from Russia. Of course, we have AstraZeneca from the United Kingdom and Sweden. Of course, we have Pfizer from the United States and Germany. And of course, Johnson & Johnson, Moderna, and Novavax, also from the United States. There are only 3 that are available in the US, and these are the Pfizer, the Johnson & Johnson, and the Moderna. They don't have Astra there. Okay? Now, of course, the vaccines in development went through the usual scientific process of preclinical trial, okay, to phase 1, phase 2, phase 3. And I'm presenting to you this slide so that you can see that there are more hopes coming. There are 184 vaccines being experimented in laboratories and in animals in the preclinical stage. There are 35 others in phase 1, 28 others in phase 2, 25 in phase 3, while we have 17 in use. And 5 vaccines now are being studied and monitored in a wider population in a phase 4. You know, the humanity won't give up on developing what needs to be done to fight this pandemic. And soon enough, indeed, there will be, you know, a silver lining in this experience. And humanity will evolve stronger than ever, you know, believing in hygiene, you know, embracing science, learning technology. You know, before the pandemic disruption was the fear for the disruption brought about by the 4th Industrial Revolution. You know, the artificial intelligence, the machine learning, the big data, you know, the Internet of Things. These were topics of conversation before the pandemic came. And we were afraid of the fire, the 4th Industrial Revolution. But when the pandemic came, we all went into online banking. We learned e-commerce. We learned to sell online, and we learned to learn virtually. And they say that the pandemic experience accelerated the technological disruption brought about with the 4th Industrial Revolution. And because of the demand for technology, there were even improvements in the way we use technology, even in the way we teach and learn, in the way we live our lives, in doing our exchanges, our commerce, our banking system, even our communication system, and so on. So there is hope. And look at that. As of yesterday, there were 3 billion vaccines doses administered globally. And the number of fully vaccinated globally is almost 1 billion, 843 million. There are 217 countries with vaccination program, and 11% of the world population are now fully vaccinated. So hopefully and prayerfully, the mutation of the virus will be slower than humanity's ability to actually achieve the herd immunity and immunize as much people as possible. And it can be done. Look at this. Look at the cases of COVID-19 peaking sometime in April and May last year, but declining in June, and hopefully it will be within control. Hopefully we can flatten the curve. And look at the death that is still continuing. But look at the vaccine rollout and the impact in that graph that goes up. And hopefully and prayerfully, it will continue. And hopefully the vaccine will remain effective against whatever mutations the virus would undergo to develop new strains. Like there are always hopes, like the Indian variant or the UK variant, the vaccine proved that it could still be effective against it. But still, again, the appeal is not, as we embrace and rely and believe in the vaccine, we will not be dropping our guard. We shall continue the social distancing, the wearing of the mask, the hygiene that we have learned already, and some immune boosting lessons that we have learned through the pandemic experience. Now, if we will look at the number of doses administered all over the world, of course, we will readily look at the Philippines. Look at that, 1 billion in China, number one. 319 million in the United States. In the Philippines, as of June 25, 2021, we have administered 8.9 million. For 110 million population, you can already compute that we're moving there. But if we will put the Philippines in the context of how many were vaccinated already, of course, we are still lagging compared with other countries because of our population. We have 110 million population. It will be very interesting to note that like 36% of Singaporeans are already fully vaccinated, and 20% of the Singaporeans are partially vaccinated. That means about 56% Singaporeans are already vaccinated. But as you can see, you can put how many Singapores in Metro Manila alone. The population of Singapore is relatively very small. And quite easier to cover. And of course, they have a very effective technology, rich resources to supply and to support its people. Now, if you look at the Philippines, there you can see that around 4.7% of the population have been vaccinated partially at the very least. And herd immunity, as you may have heard about it, is the indirect protection from an infectious disease that happens when a population is immune either through vaccination or through immunity that they develop through the previous infection. In the context of COVID-19, herd immunity is 60 to 70% of the population being immune, meaning vaccinated or develop immunity from previous infection. It could be higher if new variants of the virus, however, are more contagious. So take note of that. 60 to 70% has to be vaccinated or develop that immunity from having had a disease so that we can say that we have achieved the herd immunity. And that's why they're making a forecast that, well, I'd like to quote some experts in immunization, like the president of the Philippine Foundation for Vaccination, Dr. Lulu, who said that we will have a beautiful Christmas. We will have a happy Christmas somehow. Maybe we will have a Christmas when we can already go shopping still with our mask. Maybe that we will have relaxed quarantine. But as to whether we will drop our mask already, that's something that remains to be seen. Now look at this. There's a country in Europe called this country is something we're not very familiar with. Okay, Gibraltar. Okay, and the population of this country is only 33,000. It's 33,000, and they have fully vaccinated their people. 33,000 population for a country. Quezon City alone has 2.9 million population. Taguig alone has 800,000 population. And our smallest province in the Philippines is Batanes. It has 17,000 population. The next to that is Camiguin, which has 88,000 population. And therefore, you can put 3 of this country in Camiguin in terms of population. And I mean, it's really probably a blessing that they have a small population. But the race to the herd immunity, the top 10 countries by vaccination rate, includes the following. You might want to see them. Okay, of course, United States is already part of it. The United Kingdom, because they are very rich countries anyway. But a race to herd immunity by the leading economies includes, of course, United States, United Kingdom, Poland, okay, Canada, Netherlands, Switzerland, France, and those countries. Okay, so good luck to them. But as far as we are, I'd like to give hope to everyone as I present to you countries that have now gone mask-free. Hindi na po sila nagmamask sa mga bansang ito. Why am I presenting this to you? Because if it happens to them, it can happen to us. As to when, well, God can tell, government can help, but we have a responsibility as well. Israel has become the first country in the world to declare itself as COVID-free. The government has also removed the mandatory face mask rule there. So now people are back in their normal lives. Nearly 70% of the population there is vaccinated and mask-free. Di ba? May tamang inggit. Nakakainggit. Pero nakaka-encourage. Because if it can happen in Israel, it could happen in the Philippines. Another country is New Zealand. You know, New Zealand deserves all the praises for handling the pandemic situation so well. Since the start of the pandemic, the nation has just reported 26 deaths. And of course, that's attributed to the Prime Minister. It's because of the government's quick response and decision. New Zealand today is mask-free. In fact, a few days ago, a concert was organized in Auckland, which was attended by nearly 50,000 people without social distancing and mask requirements. So you can just imagine attending a concert again in the future. If it happens in New Zealand, maybe, hopefully, prayerfully, it will happen in the Philippines as well. Bhutan, they won the race against COVID by its vaccination drive and vaccinated more than 90% of its adult population in just 2 weeks. Well, they have a small population. Since the beginning of the pandemic, the country has reported only 1 death. Though it shares a border in India and China, the country was never actually hit by the pandemic because of its timely action. Also, Bhutan controlled the pandemic situation without even going to a lockdown. So there is hope. I'm presenting this to you because I am dreaming that soon enough we will be able to go to malls without masks. You know, I cannot breathe really with mask, and I admire and I really admire, salute our frontliners. Imagine, nakamask lang ako ng 30 minutes pag nag-grocery, I feel suffocated already. Imagine a nurse, a doctor, or our health workers in the hospitals na kailangang mag-mask, not for 8 hours, but for 12 hours. And to be in PPE could be very draining. Imagine the sacrifice. Another country that could inspire us is Hawaii. By the way, Bhutan has 771,000 population and Hawaii has only 1.4 million population. Imagine you can put 2 Hawaii in Quezon City. All right? Hawaii is no longer requiring people to wear face masks outdoors as the number of coronavirus cases drop and more people get vaccinated. Governor David Ige said Tuesday that he will maintain a requirement that people wear masks indoors, whether or not someone is vaccinated. But still, that's going to be easy. I mean, imagine Quezon City, you can put 2 Hawaii in Quezon City. So that's relatively a smaller population to manage. But look at this. It's not about being small, but it's about having the resources and the political will to really make things done. China, the biggest country in the world, where the coronavirus or COVID-19 began, is nearly mask-free now, with almost everyone vaccinated. Although masking up was once required at all public venues, authorities now say people don't need to do so while outdoors. at public gatherings or when there's in place have good air circulation. Still, people are subjected to mandatory mask wearing rules, however, nationwide at hospitals and transport hubs. I have students, I have graduate students in China, and they say indeed that wearing of mask is not anymore very strict, especially in open spaces. And I really envy them because here, even at home, when somebody's jogging by the street, you will see them wearing masks, even if you know by science that the distance would not make it possible for the virus to be transmitted, but still it gives a lot of comfort and safety to be wearing it. The United States, of course, is the last country in my list which said goodbye to wearing the mask. Fully vaccinated people in the US no longer need to wear masks or stay 6 feet away from each other in most settings, whether outdoors or indoors. The Center for Disease Control and Prevention said there are a handful of instances where people will still need to wear masks in a healthcare setting or at business that requires them. Fully vaccinated people will also still need to wear masks on airplanes, buses, trains, and other public transportation. So I'm very happy to report to you that while I successfully, probably, hopefully, presented to you the impact of COVID-19 to the economy, to the jobs that we have lost, to the businesses that have closed, and to the learning opportunities that our children missed already for more than a year. I probably have justified that the vaccination programs need to be supported, not only by government, not only by local government and NGOs, but by all of us. Imagine if we have 1,000 people in this conference and each of the 1,000 people will influence 100 others. Then you can just imagine, the cascading effect of this, the ripple effect that this would lead us into achieving the herd immunity that we're all dreaming of. And the 3 best countries in the vaccination program includes Israel, Bahrain, and United Arab Emirates. According to tracker developed by our World in Data, a research partnership between the University of Oxford and the British nonprofit Global Change Data Laboratory, 3 countries have vaccinated the highest proportion of their population than the rest of the world: Israel, UAE, and Bahrain. These Middle Eastern states have administered the jobs to 20.93%, 10.99%, and 5.24% of their populations, respectively, while the US, Denmark, and UK trail far behind at 2%, 1.9%, and 1.4%. The rest of the world is hovering around 0.5%. And the secrets that we have seen and the rest of the world has learned: number 1, reach out to the leaders of the minority of communities who are more skeptical on the vaccine, wherever they may be. Get them on board and earn their confidence. This is where we need to exert our effort to reach out to those who are skeptical about the vaccine and convince them by the language of science and by the optimism of the evidences that are available in the world that the success in managing this COVID-19 pandemic can be achieved through the vaccination program. The second is to recruit volunteers to alleviate the strain on overworked healthcare staff. For example, in Israel, they called on retired staff to vaccinate the elderly in retirement homes so that the frontline health workers could stay in hospitals and clinics. You will find out that in crisis times, people want to volunteer. You just need to ask them. And this is what we're doing actually. As the president of the UST Nursing Alumni Association, we even launched a video, and we have more communication material, education, information materials coming out to campaign not only for people to get vaccinated, but for health workers to actually take the responsibility to go out and volunteer. And lastly, invest in good digital infrastructure to process and centralize large volumes of health data, like shares of immunized people in a given area in real time. But do not do heroic IT efforts, he warns. Play with what you have and adjust it for COVID-19. These three recommendations that deduce the lessons that the world has learned came from an article in January 2021 by Timsit, and these are evidence-based documents that prescribe some things that we can adopt in the Philippines. As you may have heard, number one, go to the skeptical and convert them. Number two, ask those who can volunteer to volunteer. And number three, use the power of IT to make things happen. The Philippine Vaccination Program, as of June 28, 2021, we have reached 17 million. Not bad, really. And of course, Sinovac is attributing to the 12 million doses of these, followed by AstraZeneca, the Pfizer, Moderna, and Sputnik. Hope that there will be more to come. You know, as we can see, the fully vaccinated numbers, 2.63 million, and the total population fully vaccinated is at 2.4%. Not bad. Not bad for a country like Philippines, but of course you will agree that it can still be improved, because if other countries have done it more efficiently, the Filipinos being a country with the Bayanihan spirit very strongly ingrained in our culture, I think it can be done. And as we can see, there's already a forecast of the target for COVID-19 vaccination, its proportion to national population. There are already some projections, and we're looking really forward to the achievement or the attainment of our targets of achieving the herd immunity. All right. Total doses administered out of those available, okay, as I said, administered at 7.5 million first doses and 2.5 second doses. These are all from good sources and no less than the Department of Health. And the framework has adopted that of the world. We have the A1 to A5 of the priority eligible A and priority eligible B and the C. In many cities now, they are with A4 already. Like in Quezon City, where we operate, even in Manila, we are already trying to immunize the frontline personnel required in essential sectors, including the uniformed personnel. And we're now reaching into the indigent communities. We're really looking forward to getting more of the A4 being vaccinated, because when we can go back to work and go back to business, maybe the economy will pick up, and then it will fuel the movement of goods and services, and it will bring more food on the table and make sure that there's going to be a beautiful Christmas in the Philippines. This virus will not last forever, but there's something that, according to the Bible, will last forever. As a Thomasian, I always say that the Traya Hayek, or there are three things that last forever. And these are our faith, our hope, and our love. We should not only have faith in God and in ourselves and in our neighbors. We should have faith as well with the good intentions of our government, hopefully, good intentions of our leaders, hopefully. And let's trust each other that we all want to mean well, because we want to get out of this experience. We want to be victorious against the coronavirus, this unseen enemy that we never thought was coming and we are not prepared for. We should embrace that hope, because that hope is something that will grow in us and will be very contagious as we communicate it with others. But more importantly, I think we have learned enough the language of love, because at times of crisis like this, we can't help but find that spot in our hearts, where we will feel the compassion, and we can say that we're here because of love, and we can do better as humanity because of love. So thank you very much. And this has been Dr. Carl Balita, rallying the world, rallying the Filipinos to believe in the vaccine. Because even if I had that nightmare of almost losing a mom because of the adverse effect of this vaccine, I still believe in it. Because my mom's case is 1 in a million, and 999,999 still benefited from it. And it's always worth the risk if we want the best from this experience. God bless all of you, and the best contribution that we can really make as individuals is to break the chain, to be not part of the chain, so that this virus transmission will stop, and we should coexist if we have to with this coronavirus, and this world will still be the best place for all of us. Thank you so much. Salamat po.
Yes, thank you very much, Dr. Balita, for an extra informative presentation. I was actually saddened by the tremendous devastation that this pandemic has caused to our Philippine economy. But, I was moved by your encouraging words. Thank you very much, Doc. Well, we encourage our participants to drop their questions on the comment section below, so Doc Balita will be able to answer them. May I call on once again Ms. Micah Diao to preside the question and answer portion.
Thank you very much, Dr. Balita, for that very informative and detailed talk. Now, let's proceed to our question and answer portion. But I would like to encourage everyone to please keep on sending your questions on the chat box below to acknowledge them. For our first question from one of our viewers, from Richard Centeno Pellegrino, how does COVID-19 vaccination program help to rise again the economic of the Philippines? I think it was discussed by Dr. Balita in his presentation. And for the second question, sent by Ms. Elika Castro, what do you think the government should do once herd immunity is achieved as far as the economy is concerned?
Yeah. Hello. Thank you. Thank you for those questions. Yeah. I hope you can hear me well. Can you hear me well?
Yes, Podo.
All right. Yeah, I'm in a parking space right now. So the beauty of technology, I'm able to connect with you no matter where I am and whatever I do elsewhere. Well, the economic impact will only follow the impact of how the quarantine will be relaxed. The consumer confidence will be resumed. It's not about opening businesses. It's also about giving the consumer confidence that they're ready to come out. You can see malls. Malls have allowed their establishments to open. Malls have allowed many establishments already operate. But having the foot traffic, which will not be able to sustain these businesses, is the greater challenge. So it's all about consumer confidence. So I think what the government should do is to really communicate that it's going to be safer. Okay, that there will be more public campaigns, that self-responsibility be imposed upon individuals, not because there are rules, but because there are really wanting to end the pandemic and wanting to be responsible not only for themselves and their families and loved ones, but also for the greater community. I think that's what government should do. As we can see from the stories of those who have removed their masks already, and for our countries who have declared COVID free, while they remain to be afraid, even New Zealand, for example, had been very disciplined before, but New Zealand allowed a concert of 50,000 audience. That is to tell the world that consumer confidence can be restored the moment we achieve a certain degree of herd immunity, and the moment we become more responsible for ourselves and for the people around us.
Thank you very much, Doc, for that answer. Again, one question from one of our viewers, from Miss Maria Janelle Reza Velasco. Upon reaching herd immunity and the pre-pandemic education and business settings would be resumed, do you think there would be difference for the education and business setting after the pandemic and that before the pandemic setting? Or would we just go back to the way it is?
We will never go back to the way it was. Never. You know why? Because we have gains. We have learned a lot from the virtual learning. Simple question. Would you still like to brave the traffic in Metro Manila, for example, only to attend a class which can be conducted virtually? To be honest, you wouldn't want that. If only a professor will lecture, or if only a reporter will make a report, would you still want to leave your home when it can actually happen and be achieved in the comfort of your homes, even in an asynchronous manner that you have been used to? Why should we drop those technological opportunities that will make learning much easier and much convenient and for a lesser cost? But there are elements of learning that we should still be anchored on the face-to-face, or in the in the direct face-to-face experience. For example, assessment. If I have a nursing student, how would I know that that nursing student really knows how to give an injection, or perform a procedure? In that case, maybe, just maybe, until technology can give us already augmented reality to do that. Okay, because it's still the experiential learning which will be most reliable among many. I think there will be some elements of the learning processes that can be entrusted to technology and better off left that way. But there are areas of learning and assessment. It's not only about the delivery of the lesson, because learning has something to do with testing competencies, with assessment, with socialization. Of course, there's always that beautiful element of socialization and interaction, the human interaction. Some sessions on creativity may be necessary if it's going to be in a social space rather than in a virtual space. So what we need to do is to pick up from our current experience and learn from it, so that when the opportunity allows us to be back to the campus, we will only limit those to those that matter in the class, in the campus. But certainly one thing is sure: the teachers will be here to stay. As to whether the classroom will be here to stay, before the pandemic, by the way, before the pandemic, education was, the 21st century learner in the 19th century classroom being taught by the 20th century teacher. Did you notice that? Before the pandemic, it was the thing. We found ourselves, the 20th century teacher meets the 21st century learner in the 19th century classroom. But because of the pandemic, we seem to have been forced into the 21st century learning using this technology. You know what makes us insecure about it? Because we're not yet familiar. But the moment we get used to it, just like wearing of the mask, we complained about wearing our masks. But did we ever complain wearing our underwear? We never did. You know why? Because we grew up wearing the underwear. But if we look back in history, did our foreparents wore underwear? They did not. But we woke up, we realized that we had to wear it, and we wore it without complaint. You see? But some people would complain, why are you wearing underwear? It's more comfortable without it. So it's a matter of choice. But as to wearing the mask, I think it's going to be a lifestyle. It's not a lifestyle, but it's a living style. It will soon become a choice. Just like in Japan, even before the pandemic, people wear masks, not because of COVID or not because of bacteria, but because of the dirty air. And soon enough, we will get used to it in the same way that we will learn how to learn in the virtual manner.
Indeed, adaptivity is the key.
Yeah.
Another question from one of our viewers, Miss Con Aquino. How do you think could our fellow Filipinos help in their own little way to help our country recover from this pandemic?
Change the way you think and change the way we vote. That's the best thing we can do. If we will change the way we think, then we will be, we will be seeing opportunities rather than problems. We will be using social media for something positive rather than something negative. We will see the glass has a half full rather than half empty. We will see the sunrise, not only the sunset. We will see the rainbow at the end of the storm. That's what it will, that's going to be how it will be if we will change mindsets. It's all about mindsets. Now, as to how, the next thing we have to do is to really choose our leaders. It's election period, it's election season. And you would see already in our, especially those in the provinces, diba? You would already see, candidates with their beautiful photoshopped posters all over Nuisan's view of what is already ugly in the environment. They will cover the trees, they'll nail it to the trees, hurt the trees because of their posters. They will flood the social media with their Photoshop pictures again as if they're celebrities. When you see them in the real in the real person, you would be complaining how come it looks better in the pictures. It's the way we look at beyond the election time, election period. For now, we don't know who's running for president yet. But I think the Filipino people deserve the best president after our current one. Okay, the best president is that who could move us out of this situation. Okay, the president who can unite its people, not divide. A president who can inspire, not cause fear. A president who would pull together the best people so that we can define what is best for the country and for its people. I think that's the best part. I think that's the best contribution you can make in our own ways. We have to come out and exercise. I know this is organized by some MPA students, and I know for a fact that you can make a difference. You surely can.
Thank you very much, Dr. Balita, for that very meaningful answer. Another question from one of our viewers is Aileen A. What industry do you think is the most hit by the pandemic, and how are they going to bounce back again?
Everything is hit. It's just a matter of determining what kind of pivot you have done. Like, for example, how were we able to survive as a review center? We survived since the pandemic when there were never, except by tomorrow is the first, there was never a board exam. Then how did the review center survive without the board exam? And you call it pivot. It's a perspective of maintaining the vision but changing your strategy. Regardless of industry, the first to close and the last to open, they say, is tourism. But look at Boracay. Look at some resorts. They have bounced back. It's really not about an industry giving a magic wand or an industry being given a special attention to be able to bounce back. It's really about the entrepreneurial spirit, the resiliency and the tenacity of the entrepreneur behind it, and the creativity in the strategies that can be done that would save the day. I've known restaurants that have grown better now, but you know that I have known small brands that has expanded now. Just to tell you how many milk tea companies have closed, but you would see Corimi opens right and left. Potato corner with thousands of kiosks all over, converting it into a friable, something available in SNR that even gave them more sales. You see, you saw the amount of Maxes, for example, instead of their waiters getting orders from tables, have been trained and converted to become, riders to deliver to houses. It's all about pivot. So we cannot just say that this industry will be good. I mean, if I will tell you which industry is best, of course, the one that developed vaccines, because we will continue to have it, But the rest, the other industries are somehow pivoting and surviving and thriving. And you know what? That's the entrepreneurs don't worry about us. You know why? Because the entrepreneurs, what don't kill us will make us strong. You see, it's maybe we close 2, but we will open 3. Maybe we lost 1,000,000, but we will recover it by billions. That's what we are. That's what we do. And it's our innovativeness, it's our creativity that will make that happen. And as far as the business area is concerned, by the way, there's always an element of business friendliness. The next administration or this administration even, and people in government, whether local or national, should be an enabler to business rather than a regulator. They should be able, the MPA should understand that local governments and national governments and government agencies should be a crutch, rather than a baggage to business. They should be able to offer some relief or some assistance, or at least make business easier than before. In that way, it will be very encouraging for businesses to fight. Because if you're fighting for your own survival and your people's survival, and you will see the government, penalizing you or making it even difficult and hard for you, it can be very discouraging. And some businesses may just give up and just save themselves and their families. But for as long as there are business people who would like to save their people and the employment and the livelihood of their people, there's going to be a beautiful silver lining ahead of us. Thank you.
Thank you very much, Dr. Balita. Sorry. Another question from one of my co-MPA students. First, this is from Miss Sol Alger. Being an entrepreneur yourself, were you also affected by the COVID-19 pandemic? If yes, how do you plan to revive your business or at least recover your loss?
I don't play tennis with my eyes on the ball. I mean, on the scoreboard. I will play tennis with my eyes on the ball. The thing here is, if I will be motivated by making profit, then I'll be disappointed. I will be frustrated, and I will probably have sleepless nights. But if I shift my priorities into innovating the business so that it will adapt to the new normal or in the future, the post-pandemic scenario, if I will focus on rallying my people so that they become resilient even more, if I will move towards deepening the purpose of how I do things, that's the way to go. If you think doing business or being entrepreneurial is computing the profit, this is not the time for that. But this is the time to reinvent the way you do business. This is the time that you will innovate the way you do things and you make things happen. And this is the time to rally your people so that they'll be behind you. This is when leadership should shine. And this is where, innovativeness should focus really on the purpose. Every business that have closed or that have, trimmed down should look into how will they move towards the post-pandemic times. In that way, they'll be a visionary leader if they will still have their people behind them. And as always, the calculated risk-taking entrepreneur will always survive it. As far as my business is concerned, I launched about 10 books within the pandemic times. From 5 programs, we're now offering 25 programs. In the past, we were managing classrooms virtually for Saudi and Middle East, but now we're managing national events. You see, we're managing virtual national events. In the past, we are just review centers, but now we're even deploying our nurses and our doctors for COVID vaccine centers. How did that happen? Because there was a leader who can be visionary enough to see the need from around, and in the future, there is a team to support it, and there is a strategic positioning that is resilient but is agile enough to be flexible and make the most of every situation.
Thank you very much, Doc. Again, another question from Ms. Sol Alger. You have mentioned that about unemployment, there were many OFWs who were repatriated, and maybe some or most of them may not be able to go back abroad. How will this affect our country or the
Right. So
economy of our country?
in the short term, it will affect because we are very dependent on the remittance. But in the long term, it will be beneficial because, ang gagaling kasi ng mga OFWs. Some of our best people are overseas. Now that they are forced to good to stay in the Philippines, their expertise will be demonstrated in what they do, including, including the service that they can offer or the products that they can develop. All we have to do is to give them the opportunity to be more meaningful, whether in an entrepreneurial way or whether as persons who can do it as not as a Filipino citizen but as a global citizen. It's about time that Filipinos, the best of the Filipinos, will serve the best interests of the Philippines. Maybe it's God's way of telling us that, hey, Filipinos, you may be preferred by the world, but you should be the best for the Filipinos. And maybe it's a blessing in disguise, that the best Filipinos will be here to give us the best service we deserve and the best product, not for the Filipinos, but for the world. Let's do it the other way around. This time, let's not only export our people. Maybe our global Filipinos, our global citizens in the Philippines will be able to create products and services worthy of being out there in the world and call it not a world class, but a Filipino class. It's about time. It's about time we shine as a nation, not only as overseas Filipino workers, but as global Filipino citizens.
Thank you very much, Doc. And for our last question, another question from my co-MPA student, Ms. Windy Baga. If you were to suggest the government about the allocation of budget, what will be your line of priority upon recovering from this pandemic?
Give it to those people who will make money out of the money. Don't give it to people who will just consume the money. If you give it to people who will just consume the money may just go in the economy as their purchase. But if the money goes to a more productive cycle of entrepreneurship, they'll be able to create jobs. They'll be able to create products. And they'll be able to create profits and solutions. That's where entrepreneurs are good at. If you only give it to the needy, that's good. It's our priority. But take a look at it. If you give it to an entrepreneur, that money will be invested to make more money, to generate jobs, to solve some problems, and then to offer some solutions. That's what we're good at. Don't forget the entrepreneurs because they are the heroes of this economy. And they will not only spend the money, they'll put it to better use and a productive use. That's going to be my priority.
Thank you very much, Doc, for the very informative and meaningful answers. I think that wraps up our topic for today. Any more questions from our viewers?
Maybe they can just message me on social media in case, because I have to rush to an engagement at 12 o'clock. Thank you so much.
Thank you very much, Doc Balita.
Well, I was actually nodding my head back here while Dr. Balita is answering all the questions. Thank you very much, Doc, for that. And it's really nice that you are with us here today because I believe all of us have a lot of questions about the Philippine economy. And thank you that you have answered most of them. Well, now let's proceed to the awarding of certificate. For the awarding of certificate, the Philippine Women's University Conrado Benitez Institute of Business Education present the certificate of appreciation to Dr. Carl E. Balita for sharing his knowledge and expertise as a resource speaker during the webinar event entitled COVID-19 Vaccination Program: The Key to Philippine Economic Recovery, held on July 3, 2021. Given this third day of July 2021 at the Philippine Women's University Taft Avenue, Manila, Philippines. Signed by Dr. Maria Victoria U. Rosas, Professor, Mr. R.B.B. Sabulao, Class Representative, and Dr. Felina C. Young, Chancellor, SVP for Academic Affairs, and OIC Dean of CBIBE. Thank you very much, Doc Balita, once again, for your participation in today's webinar. Now let's move on to the closing remarks. Before we formally end this program, may we call on Dr. Maria Victoria U. Rosas, Class Advisor in Microeconomics and Policy Analysis, MPAD 529, for her closing remarks. Let's give her a virtual round of applause.
Thank you, Ms. Bagak. This morning's activity is very timely and informative, especially with our speakers, Dr. Lacsamana, my former student, and of course, my idol, Dr. Carl Balita. Thank you very much for sharing your expertise with regard to the topic given by our students. According to Plotkin and Mortiner, the impact of vaccination on the health of the world's people is hard to exaggerate. With the exception of safe water, no other modality has had such a major effect on mortality reduction and population growth. The development of an efficacious vaccination against COVID-19, along with proper sanitation and the observance of protocols and other public health intervention are undeniably preventing increase in the number of people severely affected. Manila Mayor Yorme and his team and the rest of the government leaders are currently implementing the vaccination program with the goal of achieving the herd immunity. As mentioned by Dr. Carl Balita, the global impact of pandemic loss in the economy, particularly in the third world countries like Philippines. Even the first world, second world countries are also affected by this pandemic. Again, as mentioned, there's always hope at the end of the tunnel. To our speakers, Dr. Lacsamana and Dr. Balita, to the President of PWU, Sir Benitez, Vice President Dr. Young, faculty members, students, and the organizing class, thank you for attending this morning webinar, and let's all get vaccinated. Again, thank you and good morning.
Thank you, Dr. Rosas. It has been a fun and a wonderful afternoon for us all again. Thank you for being with us here today. And before anything else, special thanks to Microeconomics and Policy Analysis class under Dr. Maria Victoria U. Rosas and Urban Regional Planning and Philippine Administrative and Legal System class under Dr. Sionida Baes. On behalf of CBIBE MPA students, we thank you for your time and cooperation. We do hope that you had fun with us today. And please stay tuned until the end of this slide for the evaluation link and QR code. To formally end this program, let us sing and listen to PWU hymn.
Let the
Reminding everyone to please answer the evaluation form by scanning the QR code flashed on the screen or clicking the link. Don't forget to send it back to us because your accomplished evaluation form will be our basis for issuing your certificate of participation. So, no evaluation, no certificate policy. Once again, thank you so much, and we wish you a happy weekend. See you on our next webinar.